By far, the number one issue that brings patients to see me is being unhappy with how their face and neck is sagging. I think most know in their mind that they will need a face and neck lift, but because it's normal to fear a big surgery, we get many patients coming in asking if they can just get a mini facelift or just a neck lift. But there are differences, and I will talk briefly about these. Facelift, mini facelift, neck lift. They all sound similar, but they actually address very different problems. So today, let's clear up the confusion and talk about where each one really does. If you ever looked in the mirror and thought, my jawline doesn't look the way it used to, or my neck bothers me more than my face, you're not alone. Facial aging doesn't happen in one place, and that's where there isn't a one-size-fits-all solution. The key is matching the right procedure to where aging is actually occurring. A traditional facelift focuses on the mid-face and lower face. That includes sagging along the cheeks, jaws along the jawline, and loss of definition between the face and the neck. A modern facelift is not about pulling the skin tight. Instead, it lifts and repositions the deeper support layers of the face, allowing the skin to drape naturally again. The goal is simple. You should look refreshed and rested, not tight or overdone. A facelift is usually best for patients who feel like their face has fallen over time and want a more comprehensive, long-lasting improvement. Now, a mini facelift is often misunderstood. It's not a quote-unquote lesser surgery, it's a more targeted one. A mini facelift is designed for patients with early signs of aging, typically just in the lower face and jawline, but without any significant neck concerns. It involves smaller incisions, more limited lifting, faster recovery compared to a full facelift. Now, this option works well for patients in their 40s or even early 50s who want subtle improvement before aging becomes more advanced. However, our specialty has recently noticed more patients in their late 30s even coming in for a mini facelift. I might put out a video in the future about this trend, but in a nutshell, I suspect there is a real issue of filler fatigue and younger patients not liking the unnatural results fillers can give. A mini facelift is a powerful procedure that will achieve a natural, rejuvenated look that lasts 8 to 10 years. The key thing to understand is this: a mini facelift cannot do the job of a full facelift if deeper sagging is present. Choosing it simply because it sounds easier can lead to disappointment if expectations aren't aligned. So now let's talk about the neck, because for many patients, this is the real concern. A neck lift addresses the loose skin underneath the chin, banding in the neck muscles, loss of jawline definition, and fullness or heaviness below the jaw. Sometimes the face looks relatively youthful, but the neck tells a different story. In those cases, a neck lift alone can make a dramatic difference. However, it is very uncommon for someone starting to age to only have neck aging. For the vast majority of the typical aging patient, the best result actually comes from combining a facelift and a neck lift, because the face and neck age together. And this is the most commonly done surgery in my practice. On a side note, I do want to highlight that surgeons may have different ways to name these procedures. Where I trained in San Francisco, my mentor liked to call what people call a face and neck lift a lower facelift rather than just facelift. If you ask what is the most common way to name the surgery, I will admit and say a face and neck lift is probably the more common and accurate terminology. But I just carried on what my mentor did, and I still describe what I recommend as a lower facelift, but that does include the neck. Regardless of the actual terminology, the key thing is to have a detailed discussion with your surgeon and make sure that the particular areas that bother you, whether that be the face, jaw, or neck, are treated. But there are specific scenarios where an isolated neck lift is reasonable. The first one is in a young patient who has genetically a very full neck. In these patients, a neck lift will achieve the best definition, much better than just liposuction. The second scenario I've seen, which is very uncommon, is a gentleman who is adamant he just wants a neck lift. For some reason, many men just have a negative emotional reaction to the term facelift. I think these men just assume a facelift will mean their face will completely change. Even though I try to explain the face and neck are both aging and the face and neck lift is the best option, some men will insist on just a neck lift. As long as they clearly understand and it's documented that they won't have the best outcome, then I think it's reasonable to just offer a neck lift. My approach is always individualized. I don't recommend procedures based on trends or labels. I recommend them based on anatomy. During consultation, I look at where the tissue has descended, the skin quality, muscle tone, and facial balance. Sometimes surgery is the answer, sometimes a smaller approach is enough, and sometimes non-surgical options make more sense. The right plan is the one that fits you, not a name on a procedure list, and crucially, I always work with you to find a plan that you feel comfortable. Now, the only times I won't agree with what the patient wants is if it's risky and may cause harm, or if I believe there is a high chance you won't be happy with the results. If you've been confused about the difference between a facelift, mini facelift, and a neck lift, I hope this helped clarify things. If you have questions, feel free to leave them in the comments, and if you'd like to learn more about facial aging, surgical options, and how to make informed decisions, be sure to like this video and subscribe to the channel. I'll be sharing more educational content to help you understand your options and feel confident every step of the way. Hey, thanks for watching, and I'll see you in the next video.